Good afternoon. My name is Lea KNOPF. I'm a veterinarian and I'm working for the World Health Organization, Geneva in Switzerland. Today I would like to show you on the example of rabies how One Health works in practice. A small reminder about rabies. Rabies is a viral disease. It's a zoonosis and it is among the most deadly viral diseases that we know of. So still today, every 9 minutes somebody dies from rabies somewhere in this world. 40% of the death due to rabies affect children. Most of the people dying from rabies live in remote rural areas or belong to disadvantaged populations such as in slums, where there is very little access to healthcare or veterinary services. Additionally, in endemic settings, the big majority of deaths occur following the bite of a rabid dog. So why do I want to talk about rabies for your webinar? You see on the next slide 3 images that give you some reasons. The top one is a few children of a family somewhere in Africa. So what happens to this family if the breadwinner, for example their father, was bitten by a rabid dog while the man was going to work? Maybe this family already lives in poverty and has no money to pay for treatment. So if this person dies, this family will slip deeper into poverty. On the bottom, you see a boy with a goat, also somewhere in Africa. This is maybe the only goat of the family, and it gives milk to the 5 children of the family every day. And sometimes they even manage to sell off a little bit of milk, so to have an additional income. If this goat is bitten by a rabid dog and dies, the family loses a source of food, but also maybe of income. On the left side, you see a girl carrying a puppy to the next vaccination post. She benefited maybe already from a lot of awareness campaigns, and she knows that vaccinating her dog will protect her family as well. On the fourth slide, you see where rabies still occurs, mostly in Africa and Asia. There are a few areas in the world, such as Western Europe and North America and Australia, who either never had dog-mediated rabies or who controlled it successfully and eliminated it. On the next slide, these are the 3 pillars how rabies is prevented. First of all, awareness. People need to know about rabies and how dangerous it is and what they can do if they are bitten or how they can behave with dogs. And if they are bitten, that they need to seek care to prevent rabies. And this is the second pillar, timely care. If you're bitten by a suspect rabid dog, if you seek care and you receive rabies, anti-rabies vaccination and eventually rabies immunoglobulins, this is almost 100% effective in preventing onset of deadly rabies. The most cost-effective intervention, however, to prevent rabies is to eliminate it at its source by dog vaccination. So awareness, no bite, no rabies. We work together with specialists and NGOs in educational sectors for awareness material which is translated in several languages, because if you know what to do if you're bitten as first aid, this saves life. And of course, no bite, no rabies. If we look at human rabies cases and animal rabies cases or dog rabies cases in this side, we all know that this is tightly correlated. So the more rabies you have in dogs, the more human rabies cases you have. So on the slide 8, by intervening at the dog side, you have here in orange, you have the number of dogs vaccinated. In blue is the number of cases in humans, and the red line is the number of cases in dogs. Of course, proportions are slightly different, but you see here 3 examples from Mexico, Sri Lanka, and the Philippines, how the intervention at the source benefited the elimination of rabies. So we have the tools, we know what to do actually, and that's why on slide 9, there was a call in 2015 by countries and international organizations to really tackle now the goal of eliminating dog-mediated human rabies by 2030. So 2030 is the goal, is the time that is related to sustainable development goals to end epidemics from neglected tropical diseases. Now, what do we do at the global health level, and how do we practice One Health for rabies? On the next slide, slide number 10, you see 4 labels of organizations. You see the Food and Agriculture Organization, FAO. You see the World Organization for Animal Health, OIE. You see the Global Alliance for Rabies Control, and WHO. These 4 organizations work on rabies, and they work from different angles. They have different strengths and mandates. If they come, they come together with the same message to all the global communities and the countries. This will benefit this plan of eliminating rabies, dog-mediated rabies in the world. So these 4 organizations, they elaborated a global strategic plan for ending dog-mediated human rabies by 2030. They put the countries at the center because it is a catalytic plan. We need to strengthen countries so that they can respond and tackle rabies with their own capacity and technical assistance where needed. The result is this global plan you can find at the web pages of all these 4 organizations. And I encourage you to look at it to get more information. On slide 12, I give you another example how WHO works on rabies in a One Health approach. Of course, WHO provides guidance, technical documentation and guidance for countries on rabies post-exposure prophylaxis in humans. But we elaborated also on the right-hand side this blue booklet, the WHO Expert Consultation on Rabies, which spans from the epidemiology to surveillance to palliative care, vaccination strategies in dogs, quality of vaccines. So it spans over the entire portfolio of rabies and was elaborated in close collaboration and harmonized with the World Organization for Animal Health international standards on rabies. So also here a One Health approach. World Rabies Day, next slide, is an important day for all of us. So the 4 organizations do joint work or individual work on World Rabies Day, and I invite you to look at the latest videos we elaborated for World Rabies Day 2018 from the WHO side. Just have a look and enjoy. Now, this is a snapshot on what happens at the global level. Now I would like to show you some examples from countries. WHO, in collaboration with the Swiss Tropical and Public Health Institute, did some baseline studies in 10 countries to answer some of the questions like, how can One Health be better operationalized, and how can we help countries to most effectively make use of the different sectors involved. On the next slide, 15, I give you an example from Bhutan. Bhutan is a very small country north of India, and it is not the most deprived country, but still considered a developing country. So colleagues of Bhutan made surveys in remote communities and to find out what is actually happening when a dog bites people, and how do people react. Do they go to seek treatment at the hospital, or what do they know about the health status of the dog? It turned out that actually 45% of the bites inflicted to people are by owned dogs. So it's possible to find out about the dog, whether it's vaccinated or not. But unfortunately, in 66% of these biting dogs, the vaccination status was either unclear, or it was documented that the animal was unvaccinated and thus represents a risk. The good thing is also that people seem to be quite aware about the risk of a dog bite, and they go and seek post-exposure prophylaxis if the bite is severe. One has to say that post-exposure prophylaxis in Bhutan is free to the patient, so the patient doesn't pay anything. And those people who didn't go seek post-exposure prophylaxis, they said the animal was either vaccinated, they knew that the animal was vaccinated and therefore not considered a risk, or it was just a minor bite. On the next slide, 16, this is an example, just a photo from our colleagues going to hospitals to inquire how the physicians taking care of the patients arriving at the hospital after a bite take care of them, and what are the different informations they can retrieve and make use to inform their risk assessment about whether to give vaccines to the person or not. And it turned out that actually very little information from the dog side is used. And our colleagues then went back from the hospital, traced back people who arrived at the hospital back to the community to find out more about the dog side. On slide 17, this is a similar example, but from a different setting. I'm talking here about Kenya. So colleagues from Kenya, they worked together with a few district hospitals. On the left-hand side, you see a typical hospital record book where patients are registered with demographic information and type of disease or injury that they arrive. So the Kenyan colleagues then tried to find out about the animal side. So they went back to the communities to find out whether the dog was still alive. And on the right-hand side, you see sampling of a dog so taking out the brain for testing it at the laboratory, whether it's positive or not. So interestingly, on slide 18, they found out that those dogs still alive, there were at least 13% of those dogs that had clinical signs that are coherent with rabies. But unfortunately, the practice in remote areas in many such countries is that if a dog shows abnormal behavior or starts to bite more people than is usual, people kill the dog. This is the only means they often have. Sometimes it already died as well and was buried. So the colleagues had quite some detective work to find out about whether it's still possible to sample the dog. And indeed, it turned out that 70% of those dogs sampled were high-risk dogs because they were rabies positive. However, in contrast to Bhutan, where the vaccine, the anti-rabies vaccine is for free, in Kenya people have to pay. And as it is in rural settings, many people can't afford that, or they have other reasons because it's too far away, or there are stockouts of rabies vaccine in the small clinics. So only 38% of people who got actually a bite from a suspect rabid dog finally sought post-exposure prophylaxis, despite the high risk mentioned above. And this is this is shown also on the graph below, where you see that bite category on the left. So 3 is the severest, 2 is also requires vaccine, and 1 doesn't require vaccine. So most of the dogs biting were actually not vaccinated. So we don't know, and there is a risk that these people catch rabies from that dog. So this is just exemplified in countries. And I would like to give you some thoughts based on these results and examples on slide 19 about a One Health approach, how we could use this to better detect and respond. This is called integrated bite case management, where all these informations that we have on the patient or on the bite circumstances, the biting animal, can be used to make a better assessment of the situation and to respond appropriately. On slide 20, that's what happens usually. So you have on the left-hand side the community animal health workers and veterinarians and the animal health surveillance system, where there is rabies occurring in dogs. Some dogs may be vaccinated, so they are not infected through a bite. On the right-hand side, you have also you have maybe community health workers, you have hospitals, and the public health surveillance system. So what usually happens if a dog is biting somebody, this person either goes to the hospital to seek post-exposure prophylaxis, or they decide for whatever reason that they don't go to the hospital. And some of these people were maybe bitten by a healthy dog. So actually their risk, this is the brown bar on the right side with increasing risk on the top, is maybe low, because there is evidence that a dog is definitely not rabid. But nevertheless, they get costly post-exposure prophylaxis. So if everybody bitten by a dog gets post-exposure prophylaxis, this is a huge financial burden to the health system. But of course, we want to prevent that somebody dies. So therefore, and that's the next slide, it is very important that human and animal health work together to make an informed risk assessment and develop an appropriate response. So integrated bite case management, that's what we call it. It's not really new, it has been practiced in the past, but I would like to mention it here because it is a future avenue, because if it's implemented more thoroughly, because it's not only used to assess the risk for medical decision making, but it prevents also additional exposures by removing suspect rabid animals from the community if the response team is going to follow up. It can identify also additional exposed people and animals. As I told you, not everybody is going to seek post-exposure prophylaxis, so these people might be at risk, and if we find them, we may save their lives. On the other hand, as explained before, if somebody is bitten by a healthy animal that is vaccinated and shows no signs of claim of rabies even after 10 days observation period, there is actually no need to provide post-exposure prophylaxis. On the next slide, after all this theory, slide 22, I would like to show you how this works in the country. So Vietnam did a pilot study in a province for 16 months, where they had more than 500 investigations, which were either triggered by a rabid dog showing abnormal behavior or aggressive, or by people who got bitten and went to the hospital. So this triggered a One Health response from the animal health side and the human health side. So actually, it is quite interesting to see that they managed to remove 66 rabid dogs from the community, and they managed to actually do some testing of those rabid dogs to either refute or confirm that this animal was rabid. Before, this was not done. So people had no idea about whether they were bitten by a high-risk dog or not. Then also, if you put a dog under observation for 10 days, you can find out whether that dog was actually rabid during the event of bite or not. If it survives, the risk is very low, and therefore patients can stop the costly post-exposure treatment. 10% additional people exposed were detected because not everybody is going to the hospital, and particularly in Vietnam, there is quite a number of people still going to traditional healers instead of seeking post-exposure prophylaxis. They could also find out about additional suspect animals, which also could be either put under observation or removed for the community and so don't consist a danger anymore. By this joint intervention and One Health approach, they managed also to ensure that all the bite victims actually went to the hospital and completed post-exposure prophylaxis where that was indicated. Now, the success of this pilot made Vietnam to decide that they want to scale this up. And some modeling was done to show what that would mean. And actually, it's impressive to see that in a country which heavily relies on post-exposure prophylaxis and still needs to step up with dog vaccination, that around 16,000 unnecessary post-exposure prophylaxis could be prevented, and there are considerable savings for the healthcare system. Now you will say, well, to trigger a response like that with 2 teams, that will be an additional cost. So actually, looking at the operational cost of these joint response teams and enhanced communication between the 2 sectors was fairly low per community. So these were a few examples that I wanted to show you how the One Health approach is put in practice for rabies. I invite you to look at our webpage and to find additional examples from countries or additional information that you may be interested in. And I wish you here a very nice continuation of your webinar.